In this video, we're going to talk about the top 10 highest paying jobs. So before starting, please like this video and subscribe to this channel for our future updates. Healthcare employment topped the list of the highest paying occupations, and the sector's future is quite bright. According to the US Bureau of Labor Statistics, employment of the healthcare occupation is projected to grow 16% from 2020 to 2030, adding about 2.6 million new jobs. This growth is mostly attributable to an older population, resulting to greater demand for healthcare services according to the agency. According to the US Department of Labor Bureau of Labor Statistics, there are over 700 different occupations with salary and other data in hundreds of different industries. And presumably, there are many more vocations than what the BLS has reported. With the expansion of web-based and technology-based employment, there are rising vocations with diverse job duties, and not all are accounted for. There are many different jobs and numerous opportunities. Here are the top 10 highest paying jobs, so let's start. Number 10. Internal medicine physicians. Another medical role takes up the 10th position. As you might expect, internists, who are typically employed as primary care physicians or hospitalists, are medical professionals who specialize in the treatment of adult patients. Internists who work in primary care, like other general practitioners, visit a large number of patients and are responsible for treating a wide range of diseases, from asthma and diabetes to high cholesterol and hypertension. With visits typically lasting 15 to 30 minutes, the ability to make quick decisions is essential. Number 9. Family medicine physicians. According to the Bureau of Labor Statistics, this group includes physicians who diagnose, treat, and offer preventative care to individuals and families throughout their lives. These medical physicians frequently refer their patients to experts for more sophisticated treatment options. Patients typically visit family medicine physicians, also known as primary care physicians, for periodic exams and treatment of common health ailments such as sinus and respiratory infections, as well as chronic illnesses such as diabetes, asthma, and heart diseases. Family medicine physicians are also known as primary care physicians. Some primary care doctors specialize in treating adults, internists, or children pediatricians. As the name implies, family physicians are those who care for patients of all ages, from newborn to the very elderly. Because of the diverse nature of their patient base, family practice doctors are typically more experienced in treating a large range of medical issues. Number 8. Prosthodontists. Prosthodontists fix damaged teeth or missing teeth with artificial devices such as dental implants, dentures, bridges, crowns, and veneers. Physicians who thrive in this specialty have a strong inclination toward science, are able to diagnose complex dental problems, and possesses the mechanical acumen to properly address ailments. Many of them work with cancer patients, making it important to understand the needs of surgical patients and treat individuals going through radiation or chemotherapy. Number 7. Psychiatrists. While all psychiatrists help treat mental health issues, it's a field with a vast range of specialties. Some work on child and adolescent psychiatry, for example, while others specialize in forensic, legal psychiatry, addiction psychiatry, or consultation psychiatry, which occurs in a medical setting. Others specialize in psychoanalysis, where the psychiatrists help the patient remember and examine past events and emotions to better understand their current feelings. Psychiatrists can be found in any number of work environments: private practice, hospitals, community agencies, schools, rehabilitation programs, and even prisons. Number 6. Physicians. According to the main wage of all physicians working in all other specialties, they rank 6th overall. 18 occupational specialties include in this. Other categories include allergists, cardiologists, dermatologists, oncologists, those who treat cancer, gastroenterologists, those who specialize in the digestive system, and ophthalmologists, eye specialists. Aspects of the field include pathologists who examine bodily tissues to determine whether any abnormalities exist, as well as radiologists who evaluate medical images and deliver radiation therapy to cancer patients. Number 5. Oral and maxillofacial surgeons. In the mouth and around the jaw, oral and maxillofacial surgeons diagnose and treat a wide range of disorders, traumas, and birth defects. Among the more frequent issues they are likely to deal with are troublesome wisdom teeth, misaligned jaws, tumors, and cysts of the jaw and mouth, to name a few examples. They may also do dental implant surgery if the situation calls for it. Oral and maxillofacial surgeons typically require an undergraduate degree, a 4-year dentistry degree, and at least 4 years of residency training before they can practice. Following their training, oral and maxillofacial surgeons in the United States are required to pass a 2-part exam administered by the American Board of Oral and Maxillofacial Surgery. Number 4. Orthodontists. Orthodontists specialize in corrective measures for the teeth and often referred out by the patient's dentists. These doctors frequently take x-rays, apply braces, create mouth guards, and perform other procedures as needed. High-achieving orthodontists require good communication skills as they work with patients directly, plus strong analytical and problem-solving abilities. While some work for large orthodontic offices, others own their own practice, which requires strong management skills. Number 3. Obstetrician-Gynecologists. Doctors specializing in vaginal, ovarian, uterine, and cervical reproductive health and childbirth, known as obstetricians-gynecologists or OB-GYNs, make slightly more than the annual wages listed for orthodontists and oral and maxillofacial surgeons. Successful OB-GYNs are good at communicating information to patients that improve their health and that of their babies. They also excel in handling high-stress situations, most notably childbirths. They can occur at odd hours of the day. Number 2. Surgeons. The training required to become a surgeon takes several years of specialized training, but those who complete it are rewarded with one of the highest-paying jobs in the world. Surgery specialists may find themselves working long and irregular hours, depending on their field of expertise, while surgeons who specialize in preventative and elective procedures may have a more predictable schedule. Those who work in disciplines such as trauma or neurosurgery are more likely to work prolonged, even overnight shifts, to meet the patient needs. Surgeons are trained to undertake operations to repair damaged bones and treat diseases like cancer. Surgeons are involved in the management of the patient's care both before and after surgery. Even when they are not scheduled to work, a surgeon may be required to answer patient concerns over the phone, and on-call surgeons may be required to travel to the hospital in an emergency situation. Number 1. Anesthesiologists. Physicians who administer anesthesiatics and analgesics for pain management prior to, during, and after surgery are defined as anesthesiologists by the Bureau of Labor Statistics. This highly specialized job has risen to the top of the list of the highest-earning occupations. Anesthesiologists' work hours are directed by the schedule of the operating room, which can be lengthy, unpredictably unpredictable, because anesthesiologists are required to be present for both scheduled surgeries and emergency procedures, such as traumatic events and childbirth. They are in high demand. What do you think about this video? Let me know in the comment section below. If you enjoyed this video and want to hear from us again, be sure to hit the subscribe button before you go. Thanks for watching.